Benefits of Community Diabetic Management. Good day, everyone. My name is Aurelia Okom, and today I will be discussing the benefits of community-based diabetic management. This presentation will highlight how community-centered strategies improve outcomes for individuals living with diabetes, reduce healthcare costs, and strengthen public health. I will explore this through the 4 pillars of advanced person-centered and professional practice: clinical practice, leadership and management, education, and research, while focusing on improved access and equity, holistic support, health promotion, and cost effectiveness. Introduction. Diabetes remains one of the most pressing public health challenges globally and across the UK, affecting over 4.3 million adults. Its long-term complications, cardiovascular disease, kidney failure, blindness, and amputations, place enormous strain on individuals, families, and healthcare systems. Managing diabetes effectively requires not just hospital care, but a community-driven approach that integrates primary care, education, peer support, and preventive interventions. Community diabetic management empowers individuals to take ownership of their health, bringing care closer to where people live and work. It improves access, equity, and sustainability. As an advanced nurse practitioner, my reflections draw from both clinical experience and public health perspectives, illustrating how leadership, evidence-based practice, and holistic care transform patient outcomes. A case example is Mr. A patient with uncontrolled type 2 diabetes, early renal impairment, and social isolation. His story demonstrates how community-centered, multidisciplinary care can improve control, reduce complications, and enhance quality of life. Improved access and equity in care. One of the most significant benefits of community diabetic management is improved accessibility. Community clinics, nurse-led outreach, and mobile health units reduce barriers such as travel distance, cost, and long waiting times. This is especially vital for vulnerable groups, older adults, low-income individuals, and ethnic minorities, who often face inequities in hospital-based care. By embedding care within neighborhoods, we promote equity in health outcomes, ensuring that every patient, regardless of background, has access to consistent and high-quality support. Holistic and patient-centered support. Community-based programs allow care to be tailored to the individual within their social, cultural, and psychological context. Patients receive comprehensive support not only for blood glucose control, but also for diet, exercise, stress management, and comorbidities. Interdisciplinary teams, nurses, dietitians, pharmacists, podiatrists, and social workers collaborate to address all aspects of living with diabetes. In Mr. A's case, community intervention addressed both his medical needs and social isolation through education, peer groups, and social prescribing. This holistic approach recognizes that diabetes is a lifelong journey requiring ongoing, compassionate support. Health promotion and education. Education and health promotion are at the core of sustainable diabetic care. Community initiatives provide continuous education on nutrition, physical activity, medication adherence, and blood glucose monitoring. Culturally adapted programs make this information meaningful and accessible. Workshops, cooking sessions, and exercise classes empower individuals to make realistic lifestyle changes. When patients understand their condition and participate in self-management, they become active partners in their care, reducing complications and improving well-being. Cost-effectiveness and sustainability. Community-based diabetic management is not only clinically effective, it is economically sound. By detecting issues early and preventing complications like renal failure, neuropathy, and cardiovascular disease, community care reduces hospital admissions and lowers long-term costs. Investing in community programs ensures sustainable healthcare, making it a compelling model for policymakers and healthcare leaders seeking long-term efficiency without compromising quality. Challenges and lessons learned. Despite the clear benefits, several challenges persist. Funding limitations, workforce shortages, particularly in rural areas, and cultural or literacy barriers can affect program reach and patient engagement. Overcoming these requires collaboration, innovation, and strong policy support. From my professional experience, key lessons include collaboration among healthcare professionals, community organizations, and patients greatly improves outcomes. Empowerment reduces dependency on hospital care and boosts confidence in daily management. Prevention remains the most effective long-term strategy. Focusing on healthy lifestyles can reduce both new and existing cases. Ethical, legal, and professional consideration.